Okay, life can be crazy. You're feeling like you're sinking, just trying to find a meaning. It's time for better thinking, yeah, better thinking. Time to tune in. Let's go.
Hi, String. Welcome back to Better Thinking. This is our second episode together, talking about telehealth today. So, welcome back.
Thanks, man. Let's get onto it.
So, the purpose of today's, I suppose, episode is regarding telehealth. You know, in this COVID environment, telehealth is something that's been promoted so much. And, you know, my colleagues out there, you know, fellow psychologists in particular, this is a topic they keep asking about in terms of, you know, can we cover it, discuss it, and, you know, look at some of the pros and cons. And I really wanted to talk about this because I'm passionate in this space. I've got a very strong biased opinion on what telehealth can offer, but I want to make sure that I provide that wider sort of picture and hopefully represent both sides. So make sure I'm accountable, String, because otherwise I'll go on a bit of a tangent.
Yeah, no worries. I know, look, it's been pushed through pretty quickly now, and it's a hot topic. It's a hot topic, and even discussion here around strategic between the psychologists. There's a little bit of mixed, but I think you explained it quite well at the meeting last week. Why it won't work for strategic psychology, and I'm sure you'll get into that. But yeah, I'll let you run it. Like, where do you want to go to now? Do you want to explain what it is, how it works, and
Yeah. So, you know, the idea of telehealth in this, you know, coronavirus environment is to go out and create accessibility for clients who are either vulnerable or are unable to, you know, come to the office due to quarantine or you know, socially isolating reasons. So there's a real need for telehealth, meaning telephone consultations or video consultations, you know, over the internet or obviously over phone lines. So, you know, first and foremost, I think government have done an exceptional job in providing, you know, Medicare provisions, which is, you know, a rebate for clients to be able to access a psychologist, you know, Australia-wide, who have got a mental health care plan. So this is really, really positive in so many ways. One of the great challenges is that someone has to have a mental health care plan first and foremost. But the criteria has been widened so that anyone on the plan, they don't have to necessarily demonstrate that they've been affected by, you know, COVID. They can just say, you know, I would like to go out and have, you know, see a psychologist during this time, and I have a care plan, and it allows them to go out and access that. That's at least my understanding at the moment. So from an accessibility point of view, there's a great need, you know, and all of those appointments are what we call bulk billed. So what does that mean is that the client is able to access the service effectively for free. You know, there's no out-of-pocket expense, and they can do so from, you know, their lounge room, their bedroom, however they like. So great, you know, initiative there. And, you know, I think I have to applaud government, you know, to a level with regards to making that provision available.
yeah. And what about telehealth? The term telehealth has been available for some time. But now the rollout, it's the rules have been dropped on who can access it. So do you want to explain before and after, who was eligible and how it works?
So previously telehealth was reserved for those who are in a rural area in Australia who really didn't have close access to seeing a psychologist. So if you lived, you know, in a major city, you wouldn't be eligible for telehealth. But if you were more rural and there were guidelines as to how rural is calculated, you would be able to access a psychologist that way. So, you know, if you're living in you know, the outback or in an area where you'd have to drive, you know, a certain distance, you would have that criteria. Of course, you'd still need to go out and get a mental health care plan to be eligible as well. Now what they've done is just relaxed relax those provisions where you don't have to go out and live rural. You can live in the city, and so long as you've got a mental health care plan, you're eligible for that telehealth service. And so it doesn't go out and affect your face-to-face consultations, but rather is an addition.
So is with the neural, is telehealth a choice? Is it an option? Can someone just say, "Oh, I just prefer to do an online consultation"? What does it look like?
Yeah, look, at the moment, if someone with a mental health care plan client would like to speak with their psychologist from their home, they can go out and choose that, providing that the psychologist provides that service, and it's a bulk billed service. So it's really a choice. And look, that the government have promoted that immensely. There's been a huge push, to the point where a lot of psychologists feel as though they're somewhat being encouraged to go into that direction. And this is where I suppose, my views might not be necessarily popular, but this is where I differ. I think there's almost been a push to saying we need to do telehealth for safety reasons, and that, in my view, is completely wrong. I think the idea of telehealth for safety is a misrepresentation rather than telehealth for accessibility, and I think that's what the provision there is for. But I think the way that sometimes the community can see it, or even psychologists might interpret it that way, is that it needs to be telehealth to go out and ensure that we, obviously stem the flow of infection. But that to me is not my understanding. And the reasons why is psychology hasn't been asked to leave its offices, right? The risk isn't there. There's a appreciation and understanding that psychology remains an essential service. So one-on-one therapy still requires that we go out and we have in our rooms a 4 square meters per person provision, because these are the recommendations that government have gone out and said to ensure that there isn't the spread of coronavirus. We make sure that there's a 1.5 meter distancing or more. Often it's more when we're sitting down with someone because there's a coffee table in between. We ensure that there's hygiene, all the standard things, washing your hands practices, hand sanitizer. For ourselves here at Strategic Psychology, we've got spray bottles as well where we clean the tables and other surfaces, and make sure we've got gloves if you're opening doors, closing doors and the like. So all of these provisions, the 4 square meters per person rule, the social distancing are all in play. And so, there isn't a risk. These are all by government standards, to ensure that in actual fact there is, safety in the provision of providing psychological services. When we look at other essential services, often they break, or they have to break that 4 square meters or social distancing rule because of how their service looks. Clearly, dentists, they require to be looking at that inside people's mouths, and obviously they wear gloves and the like, and there's a whole lot of provisions, and they do an exceptional job. This just needs to be understood as an essential service, and hence why, still, in my view, the optimum is to see a psychologist face-to-face, one-on-one, to go out and ensure that best quality of care is upheld. And this is what we're trying to go out and achieve. Life with a toothache is not a good life, right? No one wants to live with a toothache. And likewise, no one wants to live with debilitating psychological distress because they can't go out and see their psychologist. So there's very good reason for everyone to engage with their psychologist and do it on a one-on-one basis in real time in life.
And I think if we can jump back onto the importance of in-person consultations, And you talked about this. If the telephone, the online or phone consultations were as good, then they probably would have been around much sooner. So this seems like it's a push, because it's like, oh well, we need to not have people in contact with each other. We need people self isolating. So there needs to be something said about the quality of service. So yeah, talk about that.
Yeah, absolutely. I mean, I think it's very easily expressed in the quality of a relationship. So much about the work that we do, and in actual fact, it's the work that most people do. When you think about it for yourself, I think most of us feel that a long distance relationship, with a romantic relationship, is an inferior one, and it's not something that we would choose. It's usually by necessity. Now, there's exceptions to the rule, of course, but most of us want to be close to our loved ones. Likewise, we like to see whether it's our accountant face to face and have the conversation. We want to go out and see other health professionals face to face to have that experience. We don't do, telefood where a friend goes out and sits at their home and we sit at our home and we eat food while we go out and have a conversation. We feel like that was a dining experience. All of those feel, extremely inferior. Now, the question here is about it's an essential service. And so we're trying to go out and provide an essential service at its highest quality. And I think there is superiority over face-to-face rather than that digital experience. So let me explain why as well. When we go out and look at each other through a screen or through a telephone, there is great detail that's missed, that live always captures, and that's body language. While you and I are having this conversation, all I'm actually seeing is from your shoulders up, so let's say from your armpits up, and likewise you're seeing something similar. So it's really hard to go out and see, am I crossing my arms? Are my arms relaxed? From a digital experience, it's really also hard to go out and see the detail of your face, because I'm looking at your face is only probably 4 or 5 centimeters in size. And if I look at how far my screen is, it's probably 50, 60, maybe even 70 centimeters away from me. So I'm seeing a very small image. It's extremely impersonal, and likewise, you're seeing the same back at me. I can't see your micro expressions the way that I would see in real life. So it's very hard for me to go out and see, whether there is a slight, creasing of your forehead, or how you raise your eyebrow a little bit, or maybe your eye, closing up if there is psychological tension or emotion that's about to be released. I can't capture that. Secondly, taking away body language, meaning, your legs and all the other spaces, is it's very hard to connect on that level. So we've got those problems. We've certainly also got problems of interruption of the way that we go out and speak. There's always a slight delay in this conversation. So it's very, very hard to interrupt in a sentence, which sometimes needs to occur. There's a delay, and often you see there's a slight delay in seeing my mouth move and maybe the sound, or at least a delay from when I say something to when you actually hear it. So it takes away the capacity to communicate as well. And that is highly problematic. It puts us off. It's something that disrupts the therapeutic relationship. So it's a very, very hard space to go out and improve. My voice is different as well. Whether we like it or not, your voice goes into a mic and then it projects out of my speakers, and vice versa. So there's a whole lot of nuances that get missed there as well. So it's unfortunately an inferior product, an inferior experience, unfortunately, to both client and clinician. And the clinician's role is to be able to also effectively provide that service. And I can only speak for myself, where I don't think I am nearly as uh, helpful to my clients via phone or via telehealth, because the environment shifts and it just gets in the way. And we haven't even spoken about the other issues, for example, technology problems. I had a client yesterday where there was tech problems that occurred. Actually, it wasn't yesterday, the day before, in terms of getting the client set up so they connect on the Zoom connection. They had a poor internet connection, so it was cutting out at times. It's highly disruptive to the session to go out and ask them to repeat something, because when there's a breaking connection, but it's not the whole sentence completely, it's only a small little section, but it's kind of vital. But if you actually ask someone to repeat that every single time that happens, if it's a little bit of an unstable connection, the whole session is trying to go out and do that. And we all know that internet connections have struggled since everyone's working from home. Another issue there as well. Confidentiality is an issue too, both for psychologists and client. When you come face to face at a psychology practice, there's a confidential room, and that no family members, no one's around. It remains confidential. At home, you have to find a place where maybe the kids aren't there, or a spouse isn't there, or whoever you're living with isn't there or isn't going to be coming home. So your mind's kind of somewhat preoccupied in that space too. That's not a good scenario. The psychologist has to find a space for themselves too. So it assumes the psychologist also has a reasonable space at their home to be able to achieve that as well. So there's some other great challenges there. So I think there's great there's an inferior experience, and as I say, we don't like long distance relationships. This is why business people fly the whole way across the world. They spend a day in travel to have effectively an afternoon worth of meetings. They stay there the night because they're exhausted, and then they fly back the next day. So, in total, a 4-hour meeting can be a 3-day experience or more at times. That's how important face-to-face is, and understanding that psychology is an essential service. It needs to be done properly. We don't want to put a blindfold over our dentist and say, please work on my tooth. It's causing me a lot of grief.
Yeah. And I think there has been a recognition from the industry about this as well. Otherwise, it would have been an option even before, like, oh, well, you can choose. Do you want to come in, or do you want to do phone consults? Not only if you're rural. So the who I'm not sure, is it the Australian Psychological Association who's head of this, or is it APRA, or the health department? They understand that it is an inferior service, so they can't. Yeah.
Well, the data clearly goes out and demonstrates that as well, and this also jumps into the viability conversation too. The data is very.
Sure. Yeah, there's the delay.
Exactly.
Yeah. Look, before we get into the viability of it, you are so strategic. You are making available online appointments. So let's make that clear. But controlling certain aspects of it. So the control is the psychologists are in the office because we have a stable connection. The internet's stable. It runs fast. It's a controlled environment. It's a private environment. They're still in their room. So it's allowing this, but still controlling aspects of it.
Yeah, absolutely. I mean, look, number one is above and beyond all of those, still has to be viability, because if it's not a viable service, you just don't have psychologists who can even provide the service. And this is the other side of the of the story, or of the picture. You know, I think government's doing an exceptional job, and I'm not here to poo-poo the government, because I'd hate to be Scott Morrison and you know, the whole of government. They're struggling, they don't know what to do, but they're doing an exceptional job trying. Now, what I'm advocating for is what psychology, I think, at least in my view, would benefit from, and not as an industry, but in terms of to provide an essential service to the community. This is to go out and serve the community, but the only way it can serve the community is if it's a viable service. If telehealth was something that was highly sought after, if we thought that it was, you know, a superior or at least on par as face-to-face, there is no business person in Australia who would go out and say, I'm going to invest in an incredibly expensive lease for floor space of the office. I'm going to go in and put a, you know, incredibly expensive fit out. That I'm going to go out and have all the administrative support in, you know, achieving all of these things. We would just go out and have an online booking system. People would just phone in, and someone effectively in a call center type of scenario could go out, you know, and you know, a psychologist obviously, and just run that conversation, run that meeting, and provide therapy from that level. It clearly has not occurred. There isn't anyone that's going out, at least from my appreciation, that can demonstrate to me that is the way that psychology is moving. This is why there are physical practices all through Australia, and telehealth is an adjunct rather than obviously the primary way of provision. So, you know, the proof is in the pudding. Where we're in a real sticky situation now with viability is that the government, in an attempt to create accessibility, have put in a provision under Medicare to say that psychologists doing telehealth under the Medicare codes must provide that service on a bulk billed rate only. So what that means is, let's say that the bulk bill for a standard consultation is $85, is the bulk billed fee. That would be the rebate usually if there was an additional payment that the client made to see a psychologist. So that's all well and good until we look at the viability of what it costs to run a practice and what it costs to run a service. So I'll just run you through some numbers so you can see where the cracks break down. To run a practice, to cover all costs, to make sure there's administrative staff, for leases, for fit outs, you know, for staff wages, and the many, many, many other costs to run a practice, there needs to be a certain amount of revenue. And let's say a psychology practice is going out, just to help me with my mathematics, to make this a little bit easier. Let's say a standard consultation is $170. Right, so I'm just going to be conservative about how we run these numbers. So at the moment, if a practice is able to run on $170 per consult, and the client gets a rebate of $85, that is half the consult. And so there's a gap fee of $85 as well. What that means is that a client pays $170, they get a rebate of $85 goes back into their bank account, which is what the government pays as effectively like a subsidy. And the psychologist keeps the $170 to run the practice and cover wages and so on and so forth. What government have asked from psychologists is not to be able to, well, they've said you cannot, there is no choice about this. You cannot go out and have a rebate for your clients. It has to be a bulk build. What that means is that a psychologist cannot ask for to be paid for their service of $170. The maximum they can ask for that service for the client to receive, I suppose, a rebate or the bulk billed service is $85 only. So now the service is no longer a $170 service. It's now become an $85 service, which the client does not have to go out and pay. It's also obviously now a service that's gone from face-to-face, where we clearly know is a much better service for the client, to them being at home, the clinician being at home, or potentially even in the practice, and so the client gets it for free. Having said that, you cannot operate a psychologist practice with 50% of your revenue coming in. So the government said we're going to halve your income or your revenue. Clearly, that's obviously demonstrates that's not going to be viable. So on that, if psychologists actually adopted that, and unfortunately I've seen some practices do so, and my heart goes out to them because I think they've made a fatal error. I think they're going to see incomes go down immensely, and in actual fact, I think they'll be out of business fairly quickly. And the sad thing is, not only are the job losses there, but also it means that clients are no longer being serviced. So the idea of accessibility, inadvertently has been destroyed as well, because you've got fewer psychologists on the ground. Further to this is that telehealth is very much appreciated, understood, and renowned for being an inferior, at least in my view, inferior service. So clients are less likely to even show. They're less likely to rebook. They're less likely to follow through on a referral in doing so. So I think conservatively speaking, psychologists would be very lucky to even get 50% of their clients actually willing to do that service or participate in the service as they would face-to-face. So I think when you think about, a psychologist's client load, the moment you go out and you halve their income, and then you say that 50% of their clients will actually come along or continue to attend, we've gone from a revenue from 100% down to 50 because of the bulk billing, and then down again another 50%, which takes us to 25% revenue at best to run a practice. So if I were to go out to even the most profitable companies in the world, and to an Amazon or to an Apple, and I said, sorry, Mr. Bezos, and sorry, Mr. Cook, sorry, Mr. Gates, your primary companies are now going to be on a revenue of 25%. They would immediately cut their workforce, wouldn't they?
Yeah.
Right. So all of a sudden,
no doubt,
the great services that we rely on wouldn't be there, because you just certainly couldn't go out and afford to have them. So the idea of accessibility through a bulk billing scheme is a fallacy. I think it doesn't make any economic sense, and it won't work. I think it's plain and simple. It's blindly obvious. I think blind Freddie can go out and recognise this. This just does not go out and work. Now, this isn't a criticism of the government. They can't see everything. This is a nuanced, appreciation of how psychology needs to work, how clients adopt this sort of space, all the other problems that are associated with going tele. And the only reason to ever go tele is if you cannot go face-to-face. And psychology at the moment is meeting all the health standards and provisions and recommendations to make sure that it's a safe space. 4 square meters per person, and we can even achieve that when doing couples counselling, let alone individual counselling. that we go out and we make sure that there's a 1.5 meter distancing. In psychology, there's no need for there to be, any physical contact, like for hairdressing or anything like that. So we're one of the safest industries out there to continue to maintain what is considered an essential service. Because as I said before, it's not very fun to go out and live with a toothache. That's no way to live, or it's no way to live with debilitating mental health, whether it be anxiety or depression. And we need to be encouraging the community to go and re-engage with their psychologist at their practice, so that we continue to have psychologists to provide a service for the community, not only right now, but throughout coronavirus and beyond. So there's a real important message there around how we need to maintain the integrity of what psychology brings, and to make sure that it continues to be delivered in its quality form.
Great. So just to summarize, obviously the in-person is superior. The online consultations, and I'm calling it online consultation, not telehealth, because
Sure.
In Australia, if we use the term telehealth, it's synonymous with the rebated. So that's still a better option than not getting any consultations. If you're struggling, it's still better to speak to a psychologist online than not speak to someone.
Absolutely, 100%. And look, government have gone out and given an absolute ton of money to Lifeline, for example, which is completely a telephone service, and it's a suicide, generally a suicide type service, where if someone's feeling suicidal, they can pick up the phone, contact Lifeline, and be provided with some support. So absolutely, something is better than nothing. No doubt. And I think the data is immense. Doing it completely by yourself versus having support, chalk and cheese. So yes, online or telephone services versus nothing, there's a clear winner in that race. So all those services should be maintained. What we're saying is it viable? Will we actually get accessibility in the current model to have the trained psychologist being able to provide that service? And we've also got to understand that psychologists represent the largest mental health workforce in Australia. So these provisions are somewhat putting in question the largest provider of mental health in Australia when Australia needs it most. But yes, you're right, online is better than nothing. So I'm not trying to say we should remove that. I'm just saying we should aim for the best quality of service where it's possible.
Okay, so what are you doing at Strategic Psychology? How are you're offering online?
Absolutely.
So how are you doing it?
Yeah, look, we appreciate that there's an absolute 100% need to go out and have a service that is online, whether it's through telephone or whether it's through video conferencing software. So we have gone out and provided the telehealth. So we've provided the online service to anybody who, if I can say, is quarantined or is socially isolating or chooses not to come in. There needs to be personal choice in this space. So this isn't going out and saying you must do it, face to face, because that's our model that we prefer. I'm saying that's not going to fit for every person. So we have to give the community choice around this. So everyone has the choice whether they want to come in one-on-one or whether they want to go out and use the online type of service. What we haven't been able to unfortunately provide is a bulk build rate for the reasons that I've mentioned earlier. If we go bulk build, I unfortunately have to tell all staff, and I've been very frank, I've been very transparent with staff, explaining why we can't go down that route, that we won't have anyone to serve because we won't be able to continue trading. So, we provide an online service. It's at our usual fee, so that people can go out and still have access during those times. Now, that might mean that someone who's been quarantined, they have to be quarantined for 14 days. They might go out and say, I'm not in a good space at the moment. I still need to have continuity of care and see my psychologist. So I'm going to engage while I'm there, and then I might return to face-to-face thereafter. Someone might go out and say, I don't believe that it's safe to go outdoors, and so they might have, a risk level that's, says to them, it's unreasonable to go out and do so, despite what we see from what government recommendations are, that you can go out and access essential services. People, I think need to have the freedom of choice. And so they can go out and take that as well. So they might choose to go out and say, I'm going to maintain, support in that on the online platform. My concern is that the data, at least anecdotally for me, and what it looks like in terms of how the uptake of rural telehealth services has looked to date, is it's going to be it's not going to have the adoption rate, and also from a quality experience. I don't think clients will get as much as they would than if they came in. So I'm kind of advocating of saying, come in if you feel safe enough to do so. And obviously psychology practices around Australia have, are meeting all the provisions of 4 square metres, per person in the rooms to avoid infection, social distancing, cleaning, all surfaces, etc., to make sure that everyone remains, safe and healthy. Psychology, nor is any other essential service in the business of going out to infect anybody. That's not what we're about. We're here to continue doing what we've always done exceptionally well, which is using evidence-based therapy to support people, particularly in a situation like this, where there's high levels of anxiety, high levels of stress, where there's helplessness, where we see higher domestic violence rates, and unfortunately, I think greater deterioration to come. Lots of relationship strain, financial strain. That creates arguing, irritability, anger. Greater avoidance patterns of drinking, drug use, gambling, and so on. So this is when we need to kind of think about how do we re-engage the population, the community, to continuing to see their psychologists for, the same reasons they were seeing him previously, is to, learn to live, a better life and manage their stress and anxiety and depression more effectively.
I don't have any more questions. Did you want to add anything to that, or do you have any message for your colleagues?
Yeah, look, message for my colleagues, and I know everyone is in different circumstances, so I say this with the utmost respect of not being able to appreciate everyone's context, situation, and the like. But I genuinely believe stay trading where you are. I think we can get through this. Do everything possible that you can to re-engage with your clients. Let's maintain the quality of service that we've always been able to do. And, let's also get behind the APS in particular, who's our peak, body that communicates with government to say, we're unhappy with these bulk build arrangements. Please don't cut our income in half or ask us to go in that direction, or, promote to the community that that's the way that we should be going. Because following a 50% cut and only half of those clients arriving, we're now at 25%. That's not viable. You're going to lose your workforce, your mental health workforce. So I think we need to, send a strong message to government saying this, there's a better alternative. And interestingly, it's not going to cost government anymore, because that $85 still is the government's investment in Medicare. So I think we've got a very, very strong point there. So to my colleagues, hang in there. We're doing it together. We're doing it rough and tough here as well at Strategic Psychology. But I think we keep putting this message out. We've got to stay afloat and stay in business, and no one wants to go out and reduce their quality of service. So I'm personally not going to be dictated to about doing that for any of my clients. This is me standing up for my clients. One day, maybe if I'm mandated, I'm required to go home, I will provide an online service only, because I'll still be there for my clients. But until the police, grab me and drag me out of this office, I'm here to stay, and I urge you to stay as well.
Hope you're ready for the next episode. Hey.